Welcome to today's video, where we delve into the fascinating and sometimes challenging world of the urinary system. We'll be focusing on a specific condition known as Nutcracker syndrome. This condition, though relatively rare, can significantly impact kidney function and overall well-being. Join us as we explore its causes, symptoms, diagnosis, and management. So, what exactly causes Nutcracker syndrome? The root of the problem lies in an anatomical compression. Specifically, the left renal vein, which carries blood from the left kidney, gets squeezed between two major arteries: the aorta, the main artery carrying blood from the heart, and the superior mesenteric artery, which supplies blood to the intestines. Imagine these arteries acting like the jaws of a nutcracker, hence the name. This compression can happen due to various factors, including a low body mass index, anatomical variations in the position of these arteries, or even conditions like scoliosis that alter spinal alignment. To understand Nutcracker syndrome, we need to look at the pathophysiology. When the left renal vein is compressed, blood flow is obstructed. This obstruction leads to increased pressure within the vein. This increased pressure causes several problems. First, the walls of the vein can weaken and bulge outwards, forming varices, similar to varicose veins in the legs. Second, the elevated pressure forces blood to flow backward into smaller veins connected to the kidney, and even into the gonadal vein, which drains the testicles in men and ovaries in women. This backflow contributes to many of the symptoms associated with the syndrome. Nutcracker syndrome is considered a relatively rare condition, and precise epidemiological data is limited. This is partly because many cases may go undiagnosed, as the symptoms can be subtle or attributed to other conditions. It's believed that the syndrome can occur in people of all ages, but it is most commonly diagnosed in young adults, particularly those who are tall and thin. This higher prevalence in young adults is likely related to their faster growth spurts, which can contribute to the anatomical conditions that predispose them to Nutcracker syndrome. Further research is needed to fully understand the true prevalence and distribution of this condition. The signs and symptoms of Nutcracker syndrome can vary considerably from person to person. One of the most common symptoms is hematuria, or blood in the urine. This occurs due to the rupture of thin-walled veins in the kidney as a result of the increased pressure. Patients may also experience flank pain, which is a dull or aching pain in the side or back, often on the left side. In women, Nutcracker syndrome can manifest as pelvic congestion syndrome, leading to chronic pelvic pain, pain during menstruation, and painful intercourse. In men, it can cause varicocele or enlarged veins in the scrotum, leading to pain and discomfort. Other less common symptoms can include fatigue, orthostatic intolerance is dizziness upon standing, and gastrointestinal issues. Diagnosing Nutcracker syndrome can be challenging due to its varied symptoms. The diagnostic process typically involves a combination of clinical evaluation and imaging studies. Initially, a doctor will review the patient's medical history and perform a physical exam. Urine analysis will often be done to check for hematuria. Imaging studies, such as ultrasound CT angiography and MR angiography, are crucial for visualizing the left renal vein and assessing the degree of compression. Doppler ultrasound can the blood flow velocity within the renal vein, helping to identify any obstruction. In some cases, renal venography, an invasive procedure where dye is injected into the renal vein, may be performed to provide a detailed view of the vein and confirm the diagnosis. While there isn't a universally accepted classification system for Nutcracker syndrome, it's generally understood to exist on a spectrum of severity. Some individuals may have mild compression of the renal vein with minimal or no symptoms, while others may experience significant compression and debilitating symptoms. Some classifications consider the location of the compression, differentiating between anterior and posterior Nutcracker syndrome, depending on whether renal vein is compressed between the aorta and superior mesenteric artery anterior or between the aorta and the vertebral column posterior. However, these subtypes don't necessarily dictate a different treatment approach. The treatment and management of Nutcracker syndrome depend on the severity of the symptoms. In mild cases, conservative management may be sufficient. This can include pain medication to manage discomfort, lifestyle modifications such as weight gain to increase the fat pad around the renal vein, and compression stockings to improve blood flow. If conservative measures are not effective or if the symptoms are severe, surgical intervention may be necessary. Surgical options include renal vein transposition, where the left renal vein is moved to a different location to avoid compression, renal vein bypass, where a new vein is created to reroute blood flow around the compression, and superior mesenteric artery transposition, where the superior mesenteric artery is moved to relieve the pressure on the renal vein. More recently, endovascular stenting, where a stent is placed inside the renal vein to keep it open, has emerged as a less invasive option. Currently, there are no definitive preventative measures for Nutcracker syndrome, given its anatomical nature. However, maintaining a healthy weight can be helpful, as significant weight loss can exacerbate the compression of the renal vein. Early detection and management of conditions like scoliosis may also play a role in preventing the development or progression of the syndrome. Further research is needed to identify potential modifiable risk factors and develop targeted prevention strategies. The prognosis for individuals with Nutcracker syndrome varies depending on the severity of the condition and the effectiveness of the treatment. In many cases, conservative management can provide significant symptom relief. Surgical interventions and endovascular stenting have shown promising results in relieving the compression of the renal vein and improving blood flow. However, it's important to note that recurrence of symptoms can occur even after successful treatment. Recent research is focused on improving diagnostic techniques, refining surgical approaches, and exploring new endovascular options for treating Nutcracker syndrome. Studies are also investigating the long-term outcomes of different treatment strategies to optimize patient care. Ongoing research efforts offer hope for improved management and outcomes for individuals living with this challenging condition.